The world is struck by an unparalleled virus. When the World Health Organization first called COVID-19 a pandemic on the 11th of March 2020, people do not know what awaits them and what would possibly happen. A year has passed, and the virus even becomes unprecedented as it evolves and the transmission becomes faster than it would ever be. To slow the spread of COVID-19, various mitigation strategies have been implemented, including complete or partial lockdown, travel bans, mass gathering restrictions, home quarantines, social distancing measures, and personal protective action. Nonetheless, it is still unstoppable. New multiple variants of the virus are rapidly emerging and have been identified around the world. 164 million cases in the whole, a huge population, and more than 3 million deaths are ever recorded as of today. This is seemingly a scene from a sci-fi movie we quite do not expect to happen in the reality. 164 million people who fall sick of the virus were so big, bigger than the whole population of the Philippines and South Korea combined. People are enraged. People are mad. People at the same time are hopeful and yet confused. More and more, the coronavirus has been infecting thousands of people, and every day, it is growing and spreading across humans. The virus continues to evolve, and yet the cure is still in the process of exploration and experimentation. And vaccination is not even enough for human consumption and has its limitations and restrictions. It's been more than a year since it has started, and the end of this is not quite near and certain. The virus continues to plague the lives of people regardless of race, gender, religion, age, or social status. It creates a horrific ripple effect of problems and consequences of previous relentlessly unwise actions of both the government and individuals. But who could ever be wiser in a time like this, an unforeseen time of global suffering?
Countries have experienced tremendous losses not only in the socio-economic aspects, but in literal the lives of men. It compromises not only the physical health, but also the sanity of mankind. It has triggered Herculean challenges amongst different governments, and commonly, governments find it extremely hard to cope with the situation and determine the right course of actions which result in extreme crisis. With this global health threat that affected all nations in government, each of them has responded quite differently and varies in the level of success. But a majority, countries are struggling on how to halt or even contain this virus without severely straining education, politics, economic activity, and public security. There were shortages of testing kits, shortages of medical supplies, and there are not enough health institutions to accommodate the growing number of infections. Some preventive measures have not been successful, and as well as the mitigating strategies. Only a few countries such as China, South Korea, Japan, and Singapore have been successful in flattening the curves, and Oceania countries of New Zealand and Australia have knocked it out of their territory. Whereas Italy, the USA, and the UK are facing such exponential growth. India, the USA, Brazil, France, and Turkey are top 5 on the list of the highest cases of coronavirus. This only implies they have not been successful in their approach to managing the pandemic. Turkey, the 5th among all countries with the highest number of cases, has the fastest growing outbreaks. Turkey has imposed restrictions like closing schools, universities, and cafes, and stopping prayers and halting flights to particular countries. But the restrictions have been incremental, and even with cases continuing to rise, a nationwide lockdown has not been imposed. In the French Republic, despite the world-class biological research institutes and public health system, its virus cases continues to rise to be the 4th on the list of the world's highest COVID cases. Even French health chief himself, Jerome Salomon, said that this deadly epidemic is far from over.
In Brazil, it is experiencing a surge in deaths and infections. Latin America has become a global epicenter of the virus outbreak, driven by Brazil itself with about an average of 1,000 deaths per day from the COVID-19 virus. This was later joined by the USA and India in death tolls. Mr. Bolsonaro, the president of Brazil, has dismissed the danger posed by the virus, undermined the quarantine measures adopted at the state level, and called on Brazilians to continue working to keep the economy from collapsing. He even got the virus himself, yet Mr. Bolsonaro said in an interview that he wouldn't take the vaccine. The Ministry of Health has not presented a comprehensive plan to fight the virus. And with all these challenges and lack of enforcement and strategies, the country is truly grappling to cope with the pandemic situation.
The number of COVID-19 deaths in Brazil tops 435,000. That's after Brazil recorded more than 1,000 deaths and almost 41,000 infections in the past 24 hours alone.
The USA likewise has experienced a similar situation. Like other parts of the world, it has no such experience of dealing with an infectious disease outbreak. With people unable to recognize how lethal this virus could get, the United States of America has one of the worst cases, with 29 million cases and more than 500,000 deaths. Not taking things seriously, plus slow and flawed testing, inadequate tracing and isolating, confusing mass guidance, structural racism fueling health iniquities, and a decentralized response of the outbreak led them to the wrong situation.
Officials are doubling down on a message of caution.
We need Americans to do their part. Wear a mask, socially distance, and get vaccinated when it's your turn.
In India, there has been what we call COVID inferno. India is torn by the issues of very slow vaccination rollout, creation of a variant of the coronavirus which could speed up infections, and complacency that brought people and government to ignore the disease and conduct mass gatherings. This is entirely a human catastrophe with thousands of men infected every day. Just recently, 50 doctors in India reportedly died from COVID-19 in just one day, coupled with the 700 plus doctors who died during the first wave of the virus, and this figure could be much higher. The country has just passed 25 million confirmed cases and more than 250,000 deaths since the pandemic began. Countries are now extending their help and reaching out to help India and other countries as well. Germany, France, UK, the US, Saudi Arabia, Pakistan, UAE, and the European Union have promised to provide aid and unsurprisingly helps from different non-governmental organizations, both national and international, are working out to weather the suffering of India. Private corporations and technology giants donated and pledged aid as well, like Google and Microsoft. Private individuals also have extended help towards offering donations to the various international non-governmental organizations. The global civil society has strengthened the capacity to influence and aid others for global actions and making a change in the world. People across different borders and beyond the reach of the government are working together, independently operating for certain advocacy such that mitigating the effects of the pandemic in the countries they are willing to help.
With solidarity amongst different people in different countries having similar purpose, it is not impossible to effect change and help these struggling countries during the pandemic, most especially the less developed countries. Different states need to seek help and partner with different civil societies, more so with the global civil society to counter and lessen the effects of the pandemic. And unsurprisingly, organizations have responded effectively, providing frontline aid and defend the various rights of the people across the globe that have been violated this time of the pandemic. Global civil societies respond when others fail and fill the gap in service. It channels the communication even better and helps disseminate needed information. With global civil societies and entirely the global city working together in solidarity, the world could mitigate the impact of COVID-19 and create a better post-pandemic world.